الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Handicapped Children by Professor Mahmoud Hani Sulaiman. Definition: a handicapped child is one who is experiencing a disadvantage either physically, psychologically, or socially. Disadvantage either physically, psychologically, or socially in life and is not able to carry out normal activities expected out of him, resulting from an impairment or disability. The concept or evolution of a handicap as explained by WHO is as figured in the coming slide. This slide shows that a disease process will lead to impairment, a defect in the structure and function of an organ or system. Then this impairment may lead to disability, which is inability to carry out the expected activities, or it directly leads to handicap, which is a disadvantage experienced as loss of job resulting from impairment or disability, that is to say, disturbance at the family level. Handicap may also result from impairment without an intermediate state of disability. Taking accident as an example, evolution of handicap can be explained as in the flow chart. Accident, which may lead to disease or disorder. Accident like lead to fracture of foot, which is an impairment. This lead to disability, inability to walk. This may lead to handicap, loss of job. Handicap may be either temporary on the right side, permanent, intrinsic, extrinsic, primary, or secondary. Handicap may be temporary, permanent, intrinsic, extrinsic, primary, or secondary. Extent of the problem. WHO in 1976 estimated that 10% of world's population is disabled, which is about 200 million. Disabled children constitute about 3% of children population, and usually they will have retarded growth and development, which means delayed milestones. Problems of having disability. A disabled person faces many social disadvantages as inferiority complex, inability to compete with normal persons, lack of self-confidence. In addition, they are often not included in high positions in administrative or political positions. They have poor representation in the community affairs. Classification of handicapped children. Handicapped children are classified into three groups: physically handicapped, mentally handicapped, socially handicapped. Physically, mentally, or socially. Physically handicapped children. These include handicaps resulting from either congenital defects or acquired. Congenital defects as congenital heart disease, cleft lip, cleft palate, TLIPS, etc. Or acquired due to disease or accident such as blindness, deaf mutism, injuries, paralysis, etc. To a large extent, these are preventable. Mentally handicapping. These children have sub-average intellectual function with deficits in adaptive behavior. Extent of the problem, magnitude of the problem. Causes: congenital, antenatal, perinatal, postnatal, miscellaneous. congenital, antenatal, perinatal, postnatal, miscellaneous. Congenital, Down syndrome, for example, Klinefelter syndrome, phenylketonuria, galactosemia, microcephaly, congenital hypothyroidism, other chromosomal abnormalities. Antenatal, like erythroblastosis fetalis, rubella, syphilis, toxoplasmosis, teratogenic drugs, and irradiation. Perinatal, birth asphyxia, birth injury, cerebral palsy. Postnatal, head injuries, accidents, encephalitis, lead or mercury poisoning. Miscellaneous, low birth weight, PEM, iodine deficiency, consanguineous marriages, late pregnancy beyond 35 years of age. How to diagnose? By neurological examinations, Binet test for IQ, biochemical test, cytogenetics for chromosomes. Degree of mental retardation, considered mentally retarded if IQ is less than 70%. IQ Binet's test equal mental age divided by chronological age and multiplied by 100. Grading of mental retardation according to WHO depending on IQ. Beginning from below, please. More than 100% genius. 70 to 100, this is normal. 69 to 50, this is mild mental retardation. 50 to 35, this is moderate MR, mental retardation. 34 to 20, this is severe. Less than 20, very severe. Socially handicapped children. A socially handicapped child equal whose opportunities for healthy personality development is hampered. That is to say, unfolding of potentials are hampered due to defect in social environment, as death or divorce of parents, lack of learning process, negligence, exploitation or victimization of children, illegitimacy, delinquency. A physically or mentally handicapped child also meets with social handicaps. Socially handicapped children are taken care of by child placement measures such as adoption, borsals, certified schools, juvenile home, remand homes, foster homes, and orphanage. Prevention of handicapping at different levels: primary, secondary, and tertiary. Primary, by health promotion and specific. Secondary level, by early diagnosis and trumpet treatment. Tertiary, by disability limitation. Handicapping, by rehabilitation. Primary prevention. This measure is adopted before occurrence of disease by two modes: health promotion and specific prevention. Health promotion and specific prevention. Health promotion by general measures which will prevent an individual from getting disease. They include good living conditions with safe environment, adequate nutrition, health education, personal hygiene, sex education, genetic counseling to avoid late and consanguineous marriages, efficient antenatal care. A specific protection, for example, immunization with OPV prevents polio paralysis, vitamin A prophylaxis schedule prevents nutritional blindness, immunization of all potential mothers with rubella vaccine prevents congenital rubella. Immunization with Rh negative immunization of Rh negative mothers with Rh antibodies prevents erythroblastosis fetalis. Secondary level of prevention of handicapping. This measure prevents transition from impairment to disability. The intervention is early diagnosis and prompt treatment of disease. For example, during pregnancy, early diagnosis and treatment for hypertension, diabetes, syphilis, Rh status, and tuberculosis. Among children for fractures, injuries, etc., application of traction splints, braces to prevent deformities. Tertiary level of prevention. This measure is taken once disability occurred and is found to be irreversible by two methods: disability limitation and rehabilitation. Disability limitation and rehabilitation. Disability limitation to limit development of further disability by intensive or aggressive treatment to prevent transition into handicap. For example, treatment of corneal erosis prevents blindness. Rehabilitation. This measure is applied when individual became already handicapped, so they are useful to themselves, family, and to community. By how this is done? By training and retraining by medical, social, and vocational and psychological measures. Mentally handicapped children require tender care, love, and affection. Socially handicapped children are taken care by child placement measures. Child placement measures. These are the measures by which the socially handicapped children are taken care. These measures are adoption, orphanage, and foster home. Adoption, orphanage, and foster home. Please read this. وأقول في النهاية الحمد لله رب العالمين و thank you for your good listening.